Hello, everyone, and welcome to the NCIHC Languages of Lower Diffusion Workgroup podcast. This is Jace Norton, your host. I'm excited to have this very first episode where I am hosting this podcast. And today I have a very special guest, Diane Mbombo Tite. Diane is a friend of mine that I've been acquainted with for a couple of years now. And Diane is the founder and owner of Akula Interpreting and Translation. So Diane is a wonderful resource for Indigenous and lower diffusion languages, focusing on a lot of African Indigenous languages. But just like with us, how we at MyAverage focus on the Latin American Indigenous languages, we've grown to encompass a lot of others. I'm sure that Akula has done the same. So Diane, welcome. Thank you for being here today.
Thank you for having me. I'm so honored and humbled, Jace.
Wonderful. So, Diane, if you wouldn't mind, why don't you just tell us a little bit about yourself and your background and a little bit about Akula?
Sure. So, as you mentioned, my name is Diane Mbombo Tite. My country of origin is the Democratic Republic of the Congo. It's a country in Central Africa with a population around 100 million. I'm not too sure because the last census that was done was definitely done more than 3 decades ago. So I'm coming from a family of five, and growing in Kinshasa, I've always been immersed in, I would say, a diverse environment and multilingual family. I am a mom of two and a wife of Michael Edmondson. I presently live in Albany, New York. And as you mentioned, I am the founder of Akula Interpreting and Translation LLC, which is a language service provider entity that specializes in rare language or language of low density. They call it lower diffusion language. Name it as you want, but it's language that are most of the time overlooked in certain part of the world. So I started Akula just in the midst of COVID. Coming from DR Congo as an asylum seeker myself, I faced homelessness. And during that time of fear, trauma, and pain, I understood how language was a key to my establishment and to my success. So from DR Congo, I used to work in organizations like United Nations, the British Embassy. So I was already exposed to a multilingual workforce environment. But arriving in US, and when I was in that homelessness and to my journey as an immigrant, I can see around me how some cases for either medical appointment, because we are around that subject, right, were either overlooked or care was just not provided because there was no way to connect an interpreter or have document translated. So it definitely triggered something in me. And I personally, when I arrived a decade ago, very pregnant with a toddler under 2, needed an interpreter myself. Believe me or not, when you are in that situation of fear, trauma, the language that you will feel comfortable is really the language of your soul, the language that resonates with your entire being. And at the time, it was not English. So I use the system myself, and I also use what I starved the challenge that was at the time me being homeless and seeing everything collapsing under my feet and just feed the opportunity. I look at myself, years after I get established, and I could see that I had that potential to train myself, educate myself, and become a professional interpreter. And I did that for a few years, and I really enjoyed it. The reason why I enjoyed it is because it was an amazing way to still keep in touch with my roots, to preserve that linguistic heritage, and to be able to also provide for my family. And I can see I can look, around me that in my community and other community from Middle East or from Latinos community, that same, I will say, challenge that can become also an opportunity was the same. So I started building my network, one linguist at a time, while I was being trained as an interpreter with a local agency here in Albany. And I was actually working in an office for a few years until that office got closed down. And I find myself with the network that were already there and the need that I know that existed, and that community that was just waiting to get help. So one day at a time, I print my business cards and went back to all those clients that I used to serve and just say, hey, my name is Diane. You do remember me from this previous company that was called MAMI. It was Multicultural Association of Medical Interpreters. And I say, I speak French, Swahili, Lingala, and whenever you have any, it was especially hospitals, you have a patient that need interpretation. This is my certificate of completion of the training I did, and here my resume and my phone number. So that's how I started. So I don't know, Jess, if you want me to pursue on it, because I noticed that you asked me to introduce myself and I jumped right
No, that's
into my
wonderful.
story.
Yes, well, thank you so much for sharing your story, and what an inspiring story to share. Just how you were able to go from, like you mentioned, being homeless and seeking asylum and refuge here in the United States and needing an interpreter to now being able to provide that service to others from not only your own community, but your company does, lots of other different communities, like you mentioned, in the Latino community, right? And in communities from other parts of the world who need the same types of services. I want to focus, since we are the lower languages or the languages of lower diffusion work group, I want to focus on sort of some of these issues that can come up. So you mentioned that you speak French and Swahili and Lingala, right? And I know
Yes.
that in Africa, you have, because of colonization, right, you have a lot of different countries where the sort of official language is French or maybe Portuguese or English. And then you have a lot of people that speak English and Portuguese and French, right? But then you have these indigenous communities who are speaking other languages like Lingala, for example, or Soninke, or Wolof, and they they may have, I'm assuming that most people have some limited proficiency in the sort of official language of their country. So they can speak a little French or they can speak some English. But kind of like you mentioned, especially in moments of trauma or in moments, of stress and different other factors, we tend to revert to what's most natural, what's most comfortable. And so I want to talk about, in your view and in your experiences, how important is it for people who speak these languages that are indigenous and of lower diffusion, right, that aren't the dominant sort of colonial languages? How important is it for those individuals to get access to an interpreter that can speak in their native or preferred language versus just getting a French interpreter, for example?
Yes, thank you. That's a very pertinent question. It is important to, first of all, to break that cycle of domination. I'm pretty sure most of us has been exposed to our history and to learn how indigenous people, autochthon people has been oppressed for centuries and have been literally forced to abandon and recant their culture, their language, and adopt the dominant language. So to me, it's important because when are we going to stop that cycle? The gap is already very deep between the dominant language and the non-dominant language. So playing you know, just giving a blind eye to that situation is contributing to the challenge of those populations who have to face hardship on a daily basis for things as simple as access to healthcare, access to their basic needs. So they have to overcome language barrier where they also deserve to get the same and equal access, right? Because we're talking about some policy that are in place. We're talking about like the Civil Rights Act on Title VI. So is it just something that is on paper, or is actually something that should be implemented, enforced? And for instance, hospitals should be accountable and implement them in a way that at least attempt to do that. Coming from a country where I have been myself a victim of that oppression from the dominant language, it's not a way to preserve our identity. And I really believe that traditions, various tradition, offers various or different mindset and solutions. And in Africa, we say there is a philosophy, Ubuntu. I am because we are. So in this universe, there is enough to go around. We have to be sharing resources, but putting one community in a situation where they cannot access basic needs because the language use is like excluding them. I don't think that is fair. And anytime that I wake up in the morning and I look at this business beyond the transaction that happening is really a call for me to play a key role into this language preservation, culture preservation. And as you mentioned, I am talking by experience. I came to this country, I was already multilingual. Yes, I have a thick accent. Yes, I'm not speaking like a native, but I was able to understand English, to read English very well. But in that moment, as you mentioned, you are in front of a doctor, need to give you a diagnosis. I mean, you lose all of your sense. You need to be heard and to be able to interact in a language that resonates with your soul, in a language that is connected to yourself. And doing that, even this podcast that we're doing, I'm very happy and I love English. I love language in general. And I am very pleased to speak to you in English because one, I'm practicing and I'm also want to play a role in maintaining this language preservation, and English is part of it, Spanish as well. But I have to do in my mind a mental translation. I have to work twice,
Right.
maybe more than twice. I have to compose my thoughts in my native language, and I have to work on the interpretation in my head and do the rendition. So this is internal work that sometimes is not really tangible that people can see, but this is what immigrants and people who speak the non-dominant language have to face on a daily basis.
Right. Yeah, exactly. And I think that one thing that we see a lot of is that our, people that we try to serve, many times they're used to not getting services or not being able to be understood in their native languages. And so when they show up somewhere like the hospital, they're using their limited proficiency in whatever dominant language, right? So maybe it's French or maybe it's Portuguese, maybe it's English. They're using that, limited proficiency. And when we talk about in healthcare interpreting, we're very familiar with limited English proficiency. So
Mhm.
it's easy for us to identify this person has limited English proficiency, and so we need to get them an interpreter in their native language. But when we're talking about limited proficiency in French or limited proficiency in Portuguese, it's harder to recognize because the provider is really kind of unaware, right? They're unaware that this person is speaking some French, but it's not their most comfortable language. So, what advice would you have for interpreters who are French interpreters or Portuguese interpreters who are being called to an assignment? And then when they get there, they can tell that this person that, French is not their true native language, or Portuguese is not their native language. What kind of advice would you give to those interpreters to help those patients to kind of get to the bottom of what their native language is and see if we can get an interpreter in their native language?
Sure. So actually, I also serve as an interpreter. As much as I like being a CEO and manage my business, I always have a lot of joy when I have to connect to a Lingala call, a French call, to support that linguistic bridge with my community. So, what I will give an advice to our interpreters when you went through the training, so you know your roles, right? Especially in the medical field. So, you have to make sure that you advocate. Yes, you have to make sure that you facilitate that language identification. So, I want to make sure that they're being vocal with the provider. I just want to go back to an example, right? Beside being the conduit of communication, beside making sure that I bridge that gap, I always make sure that I listen carefully to the conversation, especially in between when the doctor leave the room and maybe the nurse leave the room and the doctor has to come. That's when the patient really relax and they speak. And I can be called as a French interpreter most of the time, and I listen to them speaking Lingala and being able to express themselves easily. So then, yes, when the doctor come, of course, with the permission of the doctor, I have to explain as an interpreter that I just want to mention that, during that few break, I didn't have an interaction with the patient, but I'm also a Lingala speaker, and I can see that Lingala might be the strongest language. Do you mind, maybe if you didn't have any challenge communicating, that's fine, but do you mind checking whether Lingala can be one of the language? And if it's not Lingala, let's say it's Kikongo, because I'm from Dear Congo, I was exposed to more than 300 language. I can recognize, okay, this is Kikongo, Kitetela, or Kimongo. I don't speak the language, but I can definitely recognize or confirm. And I feel like referring other resources that can deliver the job is also part of being professional. Let's say I am not, my business profile doesn't have a lot of Mayan language. And even if I want to keep the client happy, I want to make sure that I find the resources that, like Maya Bridge, who has that etiquette, and this is your niche, this is what you understand. So working with partners in the agency who are able to deliver the job is not a limitation. It's actually, we are a team, right? We're all playing a part to do that language access. So I will encourage all the interpreters to, first of all, be trained. And I'm glad that the NCIHC has all the resources to be trained and understand your role and play it effectively.
I think it's really important to talk about these things because I think that, you know, there's so many people, just like you said, who are doing an interpretation and maybe it seems like it's going okay. And then as soon as the doctor leaves, right, they're communicating in their native language. Or maybe, you're speaking to the husband and the husband is relatively proficient in French or Portuguese, but the mother who's there, for her, it's her appointment. The husband is, translating everything to her or vice versa, right? So it's really important to try and identify, like you said, the skills to be able to identify if somebody has limited proficiency. And it's relatively easy to identify that, right? You can tell if someone has a slightly different accent, if
Yeah.
they're struggling to find words, right? You can tell that they maybe have limited proficiency. I wanted to ask quickly too, when it comes to Latin American indigenous languages that are indigenous languages from Central South America, one of the things that we see a lot of is that a lot of the people are very conditioned to believe that their languages are not languages, that their languages are dialects. And so a lot of times, and there's other factors that can contribute to this as well, but a lot of times when they're asked, what is the language that you speak best? Even though they have limited Spanish proficiency, they'll still answer Spanish because maybe in their minds they don't think of their language as a language. And so, when they're asked about what language do you speak and understand best, or do you speak and understand Spanish, they answer yes. Do you see that a lot with indigenous communities that are coming from places like Africa, where they are also kind of conditioned to not view their languages as languages and thus like kind of not self-identify that, oh, I speak Lingala, for example, that's my native language, right? Is that an issue that you see that you've seen in your line of work?
Yes, Jace, it's so spread out there. And I was just also in my mind trying to recall what could be the reason, because as I mentioned, I've been a victim myself. Growing up, I was told that Lingala, which is one of my native language, was actually people look down at you when you speak Lingala outdoor because it was not seen as part of educated people. It was literally perceived, sorry, as from a low income, not access to education. So we sometimes has to hide that the fact that we speak in Lingala, you have to speak French with that Parisian accent to pretend that you were somebody else. So it was like survival mode. Our parents, especially just to speak for my own family, they were desperate to get us educated because the circumstance, the country went is still in a turmoil. We have decades of interruption of education. The country go through a lot of conflict. So whenever your parent find you a school that is able to keep a seat for you, and I just want to tell you that education in my country of origin, for instance, and most of the African country, I might be wrong, but I think is not free. So there is a lot of investment at the parent. So they are very anxious, they are nervous. They really want you to even, they want to instill in you that French is your passport to these words. French and the dominant language, whether it's Spanish, Portuguese, that will going to bring you success. So if you don't want to fail, you rather like literally forget about your
Yeah.
native language. They are not useful. So sometimes it's kind of a mental alienation that even without thinking about it, you acting because I don't know if even trauma is able to be passed through DNA, and we just react in denial and say, oh yeah, I speak Spanish very well, when you know for sure that you don't. You might follow the conversation, but you might not be able to express yourself. And now, as one of the advocates of lower diffusion language, I make sure that I raise awareness and confirming that actually your language is definitely an added value to your persona. You are not less than the other person because you don't speak the dominant language. Is actually bringing some beautiful, I would say, value to these melting pots. And we all need each other. We need to learn from each other. So when I go to we have an interpreting clinics actually, and we specialize on bringing all those language like Dinka, Nuer, Pele, or Pohnpeian, when people have been told that, oh, this is just that dialect that you speak down there in your small island, is not going to really bring you anything in your life. I say, no, actually, this is an amazing asset that you have. This is something that can definitely help you to maintain your linguistic heritage, pass it through the next generation, but also if you take it to the next level, be able to provide for your family. Because coming from a different country as an immigrant, I will say the option that you have in a workforce is limited by your language. So people are also nervous and they are very anxious to master English, and sometimes at the expense of losing their, language, the main language. And to me, I feel like it's really important what you're doing as a work, the advocacy, to tell people that it's okay. Maybe we have been told, as a parent, I was told also that I had a couple of children who had some speech delay. And one of the experts in that, I will say, subject mentioned that it might be the fact that I was speaking to the children through so many language that they were getting confused. I
Right.
was just like, inside me, I was like, I think they're just going to be fine. Yes, there is that shock when you move from a place to different. The environment was different, the climate, but I'm pretty sure they're going to definitely pick on English. And now I have to do a tremendous effort to keep my native language in the household because my kids are completely fluent in English. There's nothing that I have to do to even, they are the one who's now like, Mama, you have to pronounce it that way. So they are teaching me on how to enunciate and open my mouth. And yeah, so it's really a work in progress, but it's really a mental work on accepting who we are because we have been told for so many years, centuries that we were less.
Yeah, absolutely. I think there's so much more that we could talk about when it comes to the preservation of native languages and the importance of reversing some of this horrible conditioning that has been placed on native indigenous communities that if you don't speak this dominant language, you're uneducated or you're poor or you're less than. I wish that we had more time. Unfortunately, our time is coming to an end, but thank you so much for joining us today on the podcast. Everyone, if you're interested in working with the Kula as an interpreter, if you speak any language that is harder to source, harder to find, you're interested in getting trained, please reach out to Deanne. She's a wonderful resource. And everyone that's watching, please stay tuned for more updates. We want to continue this conversation of how do we train interpreters of dominant languages to recognize limited proficiency, and what do we do when we encounter those situations? How can we more effectively give proper access to individuals that have limited proficiency in a more dominant language? And how do we get them to be able to get to the interpreters that are going to be the best solutions for them? So again, thank you so much, Deanne. We really appreciate having you here today. And please go ahead and follow along with NCIHC for more updates in the future. Thank you.
Thank you, Jace. It has been a pleasure.